Good afternoon, and welcome back to another podcast by the Bipolar Guy. Hi, I'm Dr. Curtis Schindler from Center for Integrated Therapies in the Bipolar Center, and today we're going to talk about what I call a decision tree. And we're going to talk about this today because I keep getting this question. What I'm seeing out there is a lot of confusion, people coming into our office, they've done a lot of different work or tried different places, they're very frustrated on a lot of levels. They're frustrated with diagnoses, they're frustrated with medications, they're frustrated with who they should go see and how they should get there, they're frustrated with insurance, they're frustrated with not moving forward for their loved one. So we're going to talk about all of these issues, and the first one's going to be, how do I figure out how and where to go? And that's a really tough question. And it's a tough answer. And the reason it's tough is because there's so many of us out there. There are lots of therapists, there are lots of psychologists, and now there's a ton of psychiatrists. Most people, when they have problems, whether it's with themselves or loved ones, will start with a psychiatrist. And they start with a psychiatrist because that seems to be the place to go for mental health. What psychiatrists do, and they are an MD, psychiatrists, let me differentiate between psychiatrist, psychologist, and therapist. Psychiatrist is an MD, and they will write the prescription for medications as well as some other things. They can do therapy, but rarely do psychiatrists use that. They usually try to run three people, 4 people through an hour, writing prescriptions for medication for mental health. Psychotropics, we call them. A psychologist is the next level down, and that's a PhD level practitioner that has studied specifically psychology and maybe with some specialties such as forensics or other things. And they generally nowadays do very little therapy as well. What they do is more testing. They do for gifted, they do testing for forensics, a lot of testing, a lot of tests. They can do therapy, they just generally don't. But if you find one in your area that does therapy and you love them, then awesome. The next level down is the therapist. And in our state, Florida, there's 3 levels of therapy. There is the licensed mental health counselor, or LMHC, and that's what my wife and I are. There's the licensed social worker with LCSW, and then there's also the LMFT, which is licensed marriage and family therapist. In theory, the LMFT should be focusing on family pretty much exclusively, working on marriages, working on family issues. They don't. In Florida, they can do anything that the other 2 can do and usually do. So they'll cross over, they'll do couples counseling, they'll do individual counseling. Some of them might even do substance abuse, and that's fine. They are qualified to do diagnostics, and they're qualified to do anything across that spectrum in mental health care, in office and out of office. The LCSW is more institutional. They've been around the longest. They're the ones that usually take insurance. They're usually in hospitals, like the VA hospital, but they can be in individual practice, just like us, and they can do the same exact thing. Their training is mostly based on social work issues, which are helping those folks out there that don't necessarily have money, but they're in danger or in danger of becoming in danger. So, like I say, mostly in the hospitals. LMHC, licensed mental health counselor, is just that. They're mental health counselors, and our focus is on mental health. So we do individual, couples, marriage counseling, pretty much everything across the board. We also have gone further and have our doctorates in specialties in that, but we are not technically psychologists. In some states, we are psychologists. My wife, Dr. Ann, is from Michigan, and she was considered a psychologist with her PhD in Michigan, not here in Florida. None of the 3 or the psychologists prescribe medications. In some states, psychologists are now able to prescribe some forms of medication for the antidepressants and such, but not in Florida. It's psychiatrists that you would go to for medications. So that's generally the first line that I hear people go. They go to a psychiatrist. Nowadays, if they don't, a lot of them are not taking insurance. We'll get into that, what the issues are with insurance. Why don't most providers take my insurance at this point is a big question. If they don't take your insurance and it's a cash pay, it's going to be a month or 2 before you get out. If they're taking insurances, I'm hearing as much as 6 months before you can get in with a psychiatrist. If you have an issue now, that's way too long. Generally with psychologists, like I said, it's mostly testing, but child psychologists do work specifically more with behavioral issues and testing as well. it could take a while to get in with them as well. Therapists, same thing. If they're taking your insurance in network, which means they're under contract with Blue Cross Blue Shield or Aetna or United, whoever it is that they're doing, they're generally going to be loaded up and backed up for a month, 2 months or so. If the provider is not taking insurance, they're an out-of-network provider, generally you'll get in a little bit quicker because it's cash pay. The reason that most providers are going to cash pay, and psychiatrists as well as the therapists, is because the insurance companies have become very difficult to work with, and they're not reimbursing very well. So that psychiatrist may charge, or that psychologist or therapist might charge $200 an hour, and the insurance might say in the contract they're going to pay $65 for this particular policy. There's thousands of policies across all the insurances, and each one is different. You'll have some that pay much better than others, some that don't. So it's a problem for therapists in a small office to be constantly doing all the paperwork for the insurance companies and chasing them down to be paid. So I would say that on insurance-only practices, they only collect maybe 75-80% of the fees due from the insurance company. For one reason or another, they don't pay, or they drag their feet. It's very difficult. You're getting less money, maybe, like I said, $65 an hour on average, and you're getting 80% of that, so you're really only getting $40 an hour, $45 an hour and plus you have additional costs with managing that those insurance programs. In a nonprofit practice that we were in, we had 4 people collecting insurance, and when I started with that nonprofit, they were $400,000 in the hole trying to collect insurance. So it's not a very profitable business, and it's a very difficult business, helping people and to do it right. So the better practitioners, the more seasoned practitioners, are asking to be compensated at their worth, and also are asking to be paid upfront as opposed to chasing insurance. You can still submit your insurance as an out-of-network policyholder, and some of the practices like ours do submit for you electronically, which is very helpful. But that's the main reason why you see people calling and saying, well, why didn't you take my insurance? You should take my insurance. This is the problem, mental health. It doesn't cover our costs of doing business as well as other things. So it just doesn't work anymore. Insurance is a problem, not just with mental health, but with doctors as well. I know a lot of doctors that are MDs that are not psychiatrists, but doctors getting out of the business because they just can't make it work anymore. It's too ponderous chasing the insurance companies. And I see a lot of psychiatrists are also pulling out and going into concierge services or doing cash only, which of course is their choice. It just changes who their demographics are. And when somebody needs help, everybody needs help. It's not just somebody who has money, so to speak. With that being said, how do I get a diagnosis? How do I know where to go? How do I find the person that can actually help my person, whether it's myself or my son or daughter or husband or wife or cousin or mom, dad, whatever it is, our loved one? How do I know that I can get a proper diagnosis, and how do I know that I'm getting appropriate help? And that's a difficult question. We call it the decision tree, and we had talked about doing a website with a decision tree on it so that people could just go in and plug in symptomology and then work their way down to, okay, here's what that person probably has with this information you've given us, and here would be the appropriate modalities or interventions that I would try for these things. It's very difficult to put that together in a website. It is being worked on, but we haven't gotten there yet. So how do I? So if you're local, most people, of course, are going to be local. There are a couple options. You can use some of the online. Since COVID, the mental health arena has opened up some huge online accesses for therapy and psychiatry. They take your insurance. They are hiring therapists, depending on what state they're in, like ourselves, LMHCs, LCSWs, and LMFTs, and they're paying them about $20, $25 an hour on a salary, and then they're just loading them up with 40 hours or so of whatever your insurance pays. So they get burned out very quickly. You don't really know who you're getting, and it's not a person-to-person. I do not like to do, as an individual therapist, I don't like doing telephonic, whether it be Zoom, telephone, or even FaceTime. I don't prefer it because we're not getting a full session. We're not getting that full contact, close person reading body language, and body language is 80 to 90% of our communication. So I'll do it in certain events, certain situations, but it's not my preference. So I think the efficacy is much lower than an in-office visit, but if you're in a place where you can't get to a therapist, then that certainly is a way to go with one of the ones that are offering. There's 3 or 4 big ones now that are offering these services where you just set up an appointment online, you give them your insurance and your credit card, and they will do therapies. But again, the efficacy, meaning the success, is going to be lower than if you were in office with a good therapist. But how do I find a good therapist? I had somebody recently, they went through 6 therapists before they found somebody that clicked, and other people have been through therapists for... Oftentimes, the people that come into our office have been doing therapy for 30, 40, 50 years, if they're older, and without much success. Some success, but with their particular thing, they still have it, they still feel unresolved. And therapists don't usually last that long. They'll switch therapists over time. So every 5 years, a new therapist, oh, my therapist retired, or whatever the situation is. So if they're local, I think the first thing that you would need to do isn't necessarily psychiatry. I think I would find a therapist local that's a professional, and go to that person and let them help you with that decision. So the therapist may say, okay, here's what I see as a possible diagnosis. I recommend you go see a psychiatrist to get, let's say you're bipolar, you're diagnosed with bipolar. The therapist would generally say, okay, I recommend we do a session or 2 sessions a week, and I also want to get you, I'm going to connect you with this psychiatrist that I work with, so that you can also get on the appropriate medications so that this gentleman or woman is stable or stabilized, and we can do good work in the office here. There you've gotten a diagnosis, and you've also gotten some referrals for help for this situation. And hopefully that's appropriate, and that takes you to where you want to go. That would be my first line. The problem is getting in with a therapist in a timely manner. And again, if you're paying for it, it's going to be quicker than if you're doing insurance. I wouldn't do that online. It's going to be difficult for someone Zoom or what have you on the phone that's going to do good diagnostics without really being with the person, spending some time with them. You can't just meet a person generally and say this is a diagnosis. So you want to be careful there. But that would get you started. If it's a crisis situation, you may end up going into the emergency room or calling 911, and if that individual is really in crisis where they're expressing some suicidal ideation or even homicidality, they would be what's called Baker Acted in Florida, which means they are taken in by the police. It's not an arrest, it's not on your record as an arrest. You haven't done anything wrong, you're just no longer safe to be alone by yourself in this situation. So they'll take you into an inpatient center that will hold you for 72 hours at minimum. And in that situation, they're going to do some diagnosis, because you will meet a psychiatrist, you'll meet generally a social worker, you'll do some therapy, but they're going to keep you safe. They're going to medicate you if appropriate, and they're just going to keep you safe. It's not a place where you're going to go to get help, so to speak. You're not going to go there to get better. You're going to go there to stabilize, so that when you come out, you can start doing the work necessary to work towards resolution or stabilization of whatever this situation is. Not our first course of opportunity, but if it's a crisis situation, you need to do that. Now, if it's crisis and you're trying to get into, it's not quite to that level of crisis, you want to get in with somebody, then you're probably going to need to pay for the services so that you can get in with somebody good. You want a good therapist, meaning seasoned, meaning maybe focused on what your client, what your loved one has. So if you have, for instance, bipolar, if you think that your brother's got bipolar, you wouldn't go to someone who specializes in child therapy. You find someone that works in the bipolar arena. If they have trauma, same thing. You're looking for a good therapist that's been doing this for a bit and has experience in trauma, and you would go to that person again, as opposed to somebody who works in geriatric. I had somebody recently that came to me, actually the husband came to me, and she had brain damage from a couple falls, and her neurologist was the first place she went, and her neurologist was sending her to a psychologist good plan that neurologist sending to the psychologist specialized in geriatric. And it didn't make any sense because this individual had brain damage and also severe trauma, PTSD. So that didn't end up happening. She ended up coming to us, and we're working with her on both things, and she's getting better. But you have to have an idea where you're going as well. They had a relationship that wasn't really appropriate. Finding that person and then sticking with that person. Consistency is very important. That person should refer you to somebody who is going to be helpful in remedying the situation. And there are remedies now for mental health disorders. We're not stuck with it forever. Bipolar, as I talked about in the first podcast, we have great success with bipolar 1, 2, and cyclothymia with great diminishment. We also, without medications and non-invasive modality. We also have that same efficacy with PTSD, anxiety, depression, sleep, migraines, traumatic brain injuries, ADHD, ADD, and more thing, pain, and other things as well. So you're not stuck with what you have, but you have to find the person, the office that is geared up to help you in that situation, and you may have to pay for it. It doesn't mean you shouldn't have to pay a lot for it, but you have to pay something reasonable. Where was it going? I went into a car dealership, and the mechanics charging $190 an hour now, and I don't know if that's reasonable, but that's what they're charging. We're not really priced any more than that, so it's interesting how people's perspectives are on this is too expensive. There's no amount of money that's worth not having a healthy person, whether it's a relationship or a familial member. Our health and our mental health is invaluable, so we need to be able to take that step to get good help. Otherwise, it's a long-term process. It breaks my heart when I hear people who've been in therapy for 30 years and are still X, or 10 years, or 5 years even, and they're not moving forward in the way that they would like to move forward. Excuse me for the lawn person outside. Hopefully it goes by quickly. It's a never-ending battle if you can't find the remedy, and I'm here to tell you there are remedies for these psychotropic issues at this point. And not psychotropic, but psychological issues. Getting a diagnosis. With that diagnosis, that gives you a lot of information. If the diagnosis is an example, I had somebody who came in and they're not married yet, but they're talking about they're engaged and they've finally moved in together, and it's not working. Something's triggered her, and she is explosive. The relationship's gotten very sideways, and he's decided she's bipolar. He brought her into our office a month or so ago. We did a consultation, and she's not bipolar. She's got complex PTSD, or complex post-traumatic stress disorder. They were both happy to hear that it wasn't bipolar, but now they have this other diagnosis and they need to remedy that. It doesn't go away. It gets worse as we get older if we let it go because of how it affects us somatically, and then of course if we're trying to remedy it through alcohol, marijuana, or other drugs. And so they decided that they had to work, and of course we work with the trauma with this individual. So it's important to get a good diagnosis, which means you need a good diagnostician, you need an experienced therapist. And then if it's appropriate to go the med route, because it's crisis, then that's where you'd start. And then you come back to go again with that therapist you're working with to go to the next route, which is to get these symptoms under control or rid of, so that that person can back to a healthy life. There are other options, especially in crisis with inpatient. Substance abuse is a very difficult mental health disorder. I don't think substance abuse is the base. I think what I generally see with substance abuse is it's bipolar or PTSD. Could be something else, and there are genetic links to this. Somebody that has a genetic link from their parents or alcoholics up the line are more likely to fall into that trap for self-medication than somebody who has no predilection towards any type of addiction. But at the end of the day, it doesn't matter. If you're stuck on the medications for whatever reason, or the drugs for whatever reason, you then become considered a substance abuser or an addict. And what I mean by that is, if you break your back and you go into a surgery and that doesn't remedy it and you're still level 8 pain, you're going to be medicated, and not as much as used to, but it's usually in the opioid arena. It used to be OxyContin and oxycodone. It's now other types of morphines and such if the pain is really severe. It's not going to take long before you are dependent upon that morphine. If they cut you off, you still need the morphine. Generally, they'll try to get you on Suboxone, they'll try to wean you off, but you're still going to be in level A pain. What are you going to do with that? So generally, they'll drink or they'll go out in the streets and get some type of remedy, and then they're considered a substance abuser. So pain is another one where people become addicted, and then substance abuse. But bipolar and PTSD are severe enough for suicidality, and they both will self-remedy with medications all the way up to heroin. They're not substance abusing because it's a fun drug. They're substance abusing because it worked and maybe still works, and now they're stuck. We have to but we have to have a sober person to do work with in the mental health arena. They generally need to go to inpatient for 30 to 60 days, get sober, get clean, and then do the work, unless they can do the work in the inpatient center. And an inpatient center is where they go and they live. They are taken care of, they're fed, they're medicated, they do group therapies, individual therapies, they might do other side things like yoga and working out, and hopefully neurofeedback in those inpatient centers. But they're there for the duration, and they're there to be helped through the withdrawals and to get sober, and that can be really helpful with substance abuse. For somebody with bipolar or PTSD, again, if it's in crisis, they can get stabilized. They're not going to remedy generally the bipolar or the PTSD, but they can be helpful. A complex PTSD isn't going to go away with an EMDR or some of the trauma-informed therapies. It's going to be helpful, but they're still going to have a diagnosable PTSD when they come out. Outpatient, different from inpatient, is you're coming into the office, meaning you're coming in once a week for an hour, or twice a week, or 5 times a week. That's where you're doing the work with most outpatient, with most therapists. In our case, you'd be coming in the office twice a week or so for an hour. If you need more work, there's a thing called IOP, which is intensive outpatient protocol. You'd come in and you'd spend 10 to 12 hours a week in the office doing things as group, individual, and other modalities that practitioners using. And then there's the partial hospitalization, PHP, which is where you're there all day, come in 8 or 9 till 5 or 6. You just don't sleep over, but you're doing work in the office all day. And it's just more hours of work. So meds are helpful with psychiatrists, with inpatient. They need to be taken consistently and as prescribed. They will have side effects, and that's the long-term process with medications, is that they do all have side effects because it is a chemical we're putting into our bloodstream that our brain doesn't really like, but it can be stabilizing and helpful. So they're great short-term. I usually say 6 months. Medications are a good, it's like a Band-Aid. It's not reparative, it's not curative. There are no curative psychotropics or psychological medications. They manage us, they kick the can down the road, so to speak. I heard it best from a psychiatrist recently who said it's as though you have a bruise or a tear on your knee. We put chemicals on it, lotions on it, then we put a Band-Aid, and then you continue, but it doesn't repair, it doesn't fix the knee, it just covers it and helps it for a bit. Medications aren't even that good because the body will repair that bruise or that tear through scabbing and such, but the brain does no longer repair itself. So the medications could be lifelong. For bipolar, they'll tell you need to be on them for life, for other things as well. And then there's all the problems that come along with that. How do I afford mental health care? I can tell you that you're paying for it one way or another. If you're paying for insurance, it's very expensive. If you're paying for medicine, it's very expensive. If you're paying for therapy, it can be very expensive over the years. And with something that's not getting resolved and you just keep doing it once a week, twice a week, all of that adds up as well. And it doesn't just add up in money, it adds up in time spent in the office, traveling to the office. It also, more importantly, ends up in lack of a lifestyle, productivity, relationships, the ability to be self-independent or self-sufficient. So somebody with bipolar or severe PTSD gets to the point where they really aren't as productive as they could be in relationships, so raising children or having a marriage or having a relationship or parents. All those relationships are deeply affected by all the mental health disorders. So that's a huge cost. and it's ongoing. And I also think it shortens our life, because if we're sick, our whole system, our whole nervous system is inflamed, our brain's inflamed, and we're not getting better by medicating it or pushing the can down the road. We have to get that person healthy. No different than if they have a bullet wound or a car accident or even cancer. You have to go and do whatever it takes to help that person to get healthy and find. There is resolution for the mental health disorders, which is awesome. There's not always resolution for cancer, but there's lots of them now. We're getting better and better. Oftentimes I'll hear parents say, I don't care what it costs, I'll do whatever I need to do for my child. And that's a great attitude, but we don't want you spending all your money. We want to figure out how to get that child healthy as quickly as possible so that they can get on their way and be successful. Even the ADDs and ADHDs, for a child, psychiatrists just write the script for a stimulant, a Ritalin or Adderall. And you have a 6-year-old kid who's on Adderall because he can't behave in the classroom or can't focus in the classroom, and now that his growth is going to be stunted. Especially if it's a boy, it's a problem because he's not going to be as tall or as big because the appetite is so suppressed, as well as other side effects. Neurofeedback is a level 1 intervention for ADD and ADHD per the American Academy of Pediatrics. Adderall is a level 1 intervention as well. So why would you not do the neurofeedback so that you don't have anything invasive? It's non-invasive, there's no side effects, and it's reparative. That person's going to be 80 to 100% better, and then they can develop normally. If it's really bad, they can start on the Adderall and then do the neurofeedback so that they can eventually, the psychiatrist can take them off of that stimulant. But that's not generally how people do it. They go to the doctor, they get the medication, and then that child's on medications for a long time, if not the rest of their life, which is really sad. Money is an issue. Things are expensive. Things are more expensive now. I hate going in the grocery store. It amazes me how expensive things are. But there's nothing more valuable than our family. There's nothing more valuable than our health, whether it be mental, physical, or both. Mental does affect our physical health negatively. Our whole life is to live our life in harmony and to have wonderful relationships and to grow and to learn and be productive. When we're unhealthy physically or mentally, and in this case mentally, we can't do that. We can't be who we are. And we know that as parents or brothers or sisters or cousins or husbands, spouses or wives. We know that we can't keep kicking the can down the road. There are resolutions for mental health things now. So hopefully you'll find the right person. I hope this helps. You can always reach out to us and we can give you some direction, but there are answers. You just have to you have to persevere. You can't just say, there's no help out there. There is help, there is hope. And hopefully this podcast will help so that your loved one can get the appropriate help so that they can start living their lives as they should, as you would hope for. Thank you very much. Have a great week, and I look forward to seeing you on the next podcast. This is the Bipolar Guy. Talk to you soon.